Hi, good morning. Good morning, and thank you all for joining me today. Yesterday, the Centers for Disease Control released a new health advisory regarding the need to wear masks. While this is a welcome and exciting update for many of us, we must now more than ever stay cautious about our health and the health of the people around us. Let me be clear. If you are not vaccinated, going indoors or crowded areas without a face mask or face covering still puts you at risk for contracting COVID-19. The rates of vaccination in the city of St. Louis and county are still low at about 38% in the city. So we encourage everyone to visit the Fema vaccination site located at the Dome downtown. You do not need a reservation, but it is preferred to have a reservation because it speeds up the process. They're open 7 days a week from 8 a.m. to 6 p.m. with varying hours on certain days based on events at the Dome. Parking is free at 6th and Cole, and if you take public transportation, you can request a free pass to come back and get your second dose. This is open to everyone, not just City of St. Louis residents, not just County of St. Louis residents, anyone in the region. And you can welcome you back if you still have to get your second dose. The St. Louis Fire Department is also administering vaccines to homebound people. So if you're unable to travel to the Dome without assistance, and if you need this help, please call the St. Louis Area Agency on Aging at 314-612-5918. For more information on the city's health order or the vaccination event at the Dome, please call the city's health department at 314-612-5100 or visit stlouis-mo.gov and click COVID-19 information on the homepage. Last but not least, as we shift a little bit towards this new normal, I encourage everyone to free themselves of the stigma of wearing masks. If you're vaccinated and still want to wear one, keep wearing it. I know I will. If you're vaccinated and don't want to wear one, please don't pass judgment on others who do. And we ask that you respect the policies of businesses who may still choose to have mask wearing as a mandate and enforce that in their facilities. This pandemic is far from over, and we must still take precautions, and part of that is respecting the autonomous decisions of others to wear masks. At this time, I'll turn it over to St. Louis City's Health Director, Acting Health Director, Dr. Frederick Echols, to talk about our new health orders. Dr. Echols.
Thank you, Mayor Jones. Good morning, everyone. Over the past 16 months, local public health agencies, government officials, and health systems have worked tirelessly to empower through the provision of accurate information and care to protect the health of residents and visitors. As we reflect on the impact of the COVID-19 pandemic, we honor those who risk their lives serving and providing care for others, give thanks to every resident, visitor, and business who worked hard to protect the health of the community by complying with previously issued health orders, and celebrate the lives of those who lost their life due to COVID-19. As a city and region, we have come a long way, but we're not yet out of the woods. Due to the increase in supply of COVID-19 vaccine, expansion of eligibility requirements for the Pfizer-BioNTech COVID-19 vaccine to include persons 12 to 15 years of age, and the ongoing daily increase in the number of residents getting vaccinated in the city of St. Louis and St. Louis County, we continue our efforts to better align our mitigation efforts. Public health trends and data reveal the metro area has reached significant benchmarks for new confirmed cases, new hospital admissions, and total hospitalized patients. However, as I mentioned before, the pandemic is far from over. The city of St. Louis and St. Louis County are simply at a place where a new strategy can be implemented. We have arrived at a point in the pandemic where we have to lean more heavily on personal accountability to prevent the spread of the virus. The intent of the change in strategy is to streamline public health measures across the city of St. Louis and St. Louis County and ensure the maximum number of people and businesses take prudent precautions to reduce the exposure to and slow the spread of SARS-CoV-2, the virus that causes COVID-19. In the city of St. Louis, we are rescinding health orders 1 through 17, which includes standard business guidance and guidance related to youth sports, and encouraging all businesses, academic institutions, religious institutions, and places of worship, government agencies, and individuals to comply with the Centers for Disease Control and Prevention guidance to further slow the spread of COVID-19 and protect the health of our community. As we move forward together, we will remain dedicated to providing quality services and accurate information to our communities. Furthermore, we will continue to work together to address vaccine hesitancy and understand the impact of COVID-19 on our community and use that information to inform our decision-making and program development moving forward. Again, we're not out of the woods yet, but we're doing our very best to streamline efforts as it relates to COVID-19 mitigation across the city of St. Louis and St. Louis County.
Good morning. More than 125 times over the past year, I've stood at a podium like this to deliver updates on the pandemic in our community. Oftentimes, the news was hard to deliver. On March 7th of last year, I stood with Governor Parson and announced the first case of COVID-19 in Missouri was in St. Louis County. 2 weeks later, I announced the first death, a nurse who worked at St. Mary's Hospital. And then a month later, I announced that there were 1,000 cases in St. Louis County. With the pandemic taking hold, we knew that we had to do something, some sort of measures to stop the spread of the virus in our community. So throughout last year, we listened to the experts, the CDC at the national level, and Dr. Fauci, and then here locally, the experts at Washington University, St. Louis University, our own public health department, and the pandemic task force. Those working in our hospitals saw some unimaginable things. As a medical doctor, working closely with other healthcare providers, I saw how contagious this virus was. I knew that doing nothing was certainly not an option. There was no cure, and the only way to slow the spread of the virus was by keeping people apart as much as possible and by wearing masks. Sadly, there was a small segment of our population to which mask wearing was an inconvenience, an impingement on their personal liberties and personal freedoms. But here's what I know. Masks save lives. Masks proved an effective weapon against the spread of the virus that we knew little about. And because of the incredible commitment from all over our community to wear masks, we now have the freedom to move about in a way that we haven't had in almost a year. Masks were a small inconvenience to get us to where we are today. It's a historic moment in the pandemic that has brought relief and hope to everyone in our community. And the overwhelming number of our residents just want to do the right thing and to take whatever steps are necessary just to keep everyone safe. While the point's been made, I want to stress it again. If you have not been vaccinated, you should continue wearing a mask. For those of you who have not gotten vaccinated, we encourage you to do so. Vaccines are widely available throughout the region, including walk-up locations where you don't even need an appointment. Yesterday, we began vaccinating the 12 to 15-year-old age group. The Pfizer vaccine was developed right here in St. Louis County, and it's approved for this age group. We strongly recommend that you get the 12 to 15-year-old kids vaccinated. We want to make sure that they can safely return to school in the fall And we want to start that vaccination process early so they aren't scrambling in July and August to get their vaccine. If you want to find opportunities on where to get vaccinated, you can go to stlcorona.com, click on the vaccine button. In St. Louis County, just like in St. Louis City, we'll vaccinate anyone who can make it to one of our vaccine locations, no matter where you live. Now, those who have been fully vaccinated may still want to wear a mask. We understand that. The majority of Americans haven't been vaccinated. And some folks just aren't ready to shed their mask yet. Please be respectful of businesses who ask you to wear a mask if you're not vaccinated. You're still a danger to get COVID-19, and you can certainly expose someone else to COVID. We want our businesses to be successful, and we know that each business is now considering whether or not to require masks of all of their patrons. Ultimately, that decision will be up to each business owner. This really is a proud moment for the St. Louis region. It's great to see more smiles. It's great to hear the stories of family members that are spending more time together because they can now do so safely because they've been vaccinated. We've made great progress, and thanks to all of you for making that possible.